Moving on to the first question, palatine tonsil develops from, and your options are first pharyngeal pouch, second pharyngeal arch, third pharyngeal pouch, and the fourth option is fourth pharyngeal pouch. The derivatives of endodermal pouches. Before that, you should know all the pouches are divided into ventral part and dorsal part. So the dorsal part of first and second endodermal pouch joins to form a tube, and here you can see the first ectodermal cleft also invaginates to meet that tube from your pouches. So here the dorsal part of first two pouch joins to form a tube called tubotympanic recess. The proximal part is narrow, which forms auditory tube, and the distal part is dilated to form middle ear cavity. And this is the invagination from the first ectodermal cleft. We know the opening is external acoustic meatus, and at this site where it meets the development from the endodermal pouch is the formation of tympanic membrane. So we should know the tympanic membrane develops from all the three germ layers. So what happens to the ventral part of first pouch? It is obliterated due to the formation of tongue. What happens to the ventral part of your second pharyngeal pouch? Yes, this is where the palatine tonsil is developed, and the tonsil invaginates deeper into the mesoderm, and the lymphocytes from the mesoderm it enters your palatine tonsil. Part of the tonsil degenerates and it forms intratonsillar cleft. Just remember, the ventral wing of your second endodermal pouch persists as intratonsillar cleft. So dorsal part we know it takes part in the formation of tubotympanic recess. Moving on to the third pouch, ventrally it forms a gland called thymus, dorsally inferior parathyroid gland. Fourth pouch, ventrally it participates in the formation of lateral part of thyroid gland, dorsally it forms superior parathyroid gland. So just remember, the thymus descends down into the thorax. When it descends down, it also takes your inferior parathyroid along with it. So we have four endodermal pouches, and we saw the derivatives. What happens to the fifth endodermal pouch? Actually, it is seen only for a brief period during development. In some species, it is said to be given ultimobranchial body. But what happens in man? Its fate is controversial. It is generally believed that the fifth pouch incorporated with the fourth pouch to form a complex called caudopharyngeal complex. You have to remember only 2 points. This caudopharyngeal complex gives rise to parafollicular C cells of the thyroid and some part of the thyroid gland, that is lateral part of the thyroid gland, sometimes also superior parathyroid glands. Let's move on to the second question. After venesection of the great saphenous vein, the patient presents with severe pain and hypothesia on the medial side of the great toe. What is the nerve involved? So during venesection, so when you deal with your vein, the medial vein, that is great saphenous vein, what is the nerve involved? So there is a nerve which is closely associated with your great saphenous vein along its entire course. Let's see what is the nerve. Okay, before that let's associate with our femoral triangle, femoral sheath, inguinal ligament, some important structures in the lower limb. Okay, so the content of femoral sheath, medially you have femoral vein, laterally you have femoral artery, and femoral nerve is out of your femoral sheath. And these are the contents of femoral triangle. See, this nerve, femoral nerve, divides into anterior and posterior division by a branch from the femoral artery called lateral circumflex femoral artery. This artery splits your femoral nerve into two divisions. Just remember, from the anterior division you have only one muscular branch to the sartorius. Remaining branches are cutaneous. What are the cutaneous branches? So femoral nerve is the nerve of front of thigh. So the cutaneous branches are medial cutaneous nerve of thigh, intermediate cutaneous nerve of thigh, but the lateral cutaneous nerve of thigh is a direct branch from lumbar plexus. Moving on to the posterior division, it gives only one cutaneous nerve, remaining are your muscular branches. What is that one cutaneous nerve? This is the saphenous nerve. So the saphenous nerve, it just crosses your femoral artery from lateral to medial side, enters the adductor canal in the medial side of the thigh, becomes the content of adductor canal, then it pierces the roof of the adductor canal and descends downwards along the medial side of the leg, and it supplies the medial side of the dorsum of foot till the ball of the great toe. So this is the nerve which associates with the great saphenous vein. So when we do venesection of the great saphenous vein, the nerve commonly involved is saphenous nerve, which is a branch of posterior division of femoral nerve. Moving on to a third question. Esophagus commences at lower end of cricoid, C5 vertebra, 10 cm from the incisor, C7. Yes, we know it commences at the lower end of the cricoid cartilage. Okay, let's see. Your larynx extends from C3 vertebra, that is your epiglottis, and this is the end of larynx. So your larynx extends from C3 to C6. At the level of C6 is the cricoid cartilage. After cricoid cartilage, it commences as trachea. Okay, similarly, the pharynx also extends from C3 to C6. Below the level of C6, it becomes esophagus. So just remember, extension of both larynx and pharynx, they are from C3 to C6. Below that it becomes trachea and esophagus respectively. Okay, this esophagus pierces the diaphragm. We know Voice of America 8, 10, 12, right? T10 vertebra. So esophagus pierces the diaphragm at the level of 10th thoracic vertebra. After piercing, it extends a little to form the stomach. So what is the lower extension of esophagus? It is still T11. So the extension is from C7 to T11. Okay, what is the constriction at the commencement of esophagus? That is cricopharyngeal sphincter. And when you measure the length from the cricopharynx to the cardiac sphincter of stomach, it is 25 centimeters. But when we introduce esophagoscopy, we normally measure from the incisor tooth, and that is 40 centimeter. While introducing the esophagoscopy, we should know there are few constrictions in the esophagus. And what is the length of those constrictions from the incisor tooth? So while introducing esophagoscopy, there is first constriction at the level of cricopharyngeal sphincter, that is at the level of C6, where the cricoid cartilage is present, and that is 15 centimeter from the incisor tooth. And when you go down around at the level of 23 centimeters, there is again constriction due to the crossing of aorta and left main bronchus. So second constriction is at the level of 23 centimeters. Third constriction when it pierces the diaphragm to enter the abdomen, and this is at the level of 40 centimeters. So these are the three main constrictions of esophagus. Moving on to the next question. What are the structure passes along with the esophagus in the esophageal opening of the diaphragm? So we know we have three major openings. You have few other minor openings. Let's talk only about the major openings at the level of T8, T10 and T12. And 8th is your inferior vena cava, 10th is esophagus, 11th is aorta. Now what are the other structure which passes along with your inferior vena cava at the level of T8? If you're comfortable, you can follow this mnemonic. Inferior vena cava, they always have inferior feelings. Let's say RIP to those feelings. Yes, what is RIP? RI is your right and P is your phrenic nerve. So this is your most commonly asked question. Structure passing along with the inferior vena cava is your right phrenic nerve. At the level of 10 we have esophagus. And what passes in the esophagus? Yes, food. Yes, we love that. LOV. Okay, what is L? That is your left gastric artery. That is esophageal branch of the left gastric artery. V stands for vagus nerve. This question has also been asked several times. Okay, and third opening at the level of T12, that is aortic opening. Structure passing along with the aorta is T, stands for thoracic duct. Thank you. Let's discuss few other questions in the next video.